I'm here in Chicago at the ASCO meeting, and I will present the data of the FORTE trial, focusing on the comparison of KRD plus transplant or without transplant in patients with high risk and standard risk features. And basically what we saw is that both treatments, KRD with transplant and KRD without transplant, were highly effective, inducing high-quality responses and inducing high rate of minimal residual disease negativity, around 50% overall. We also saw that the rate of a minimal residual disease negativity was high in standard risk, 69–64%, and also in high risk, because about 50% of high-risk patients treated with KRD with transplant or without transplant got into minimal residual disease negativity. What we saw, however, was that patients receiving transplant have a higher rate of sustained minimal residual disease negativity at 1 year, 90% versus 72%. And this is probably the reason why in high-risk patients we found that transplant was of benefit, because it reduced the risk of early relapse, meaning of relapses within 18 months from the start of therapy. So with this trial we can conclude that both regimens, KRD plus or minus transplant, are effective. Transplant is of course of benefit at present in high-risk patients because it induced more sustained response over time. We need a longer follow-up to see the progression-free survival and if this data can be translated into changes in clinical practice.